Let's go.
Hi, my name is Dr. Brittany Ahmed, and I'm a fellow in Dallas, Texas. I'm reporting from ACR 2018 for Room Now. And one of the best parts of this conference is the ability to have an international collaboration. And because our world is becoming increasingly globalized, and as well as our patient populations becoming more diverse, I thought I would do a segment on interviewing young rheumatologists from across the world. So I have the privilege of having with me today Dr. Igebu, and she is from the Lagos Teaching Hospital in Lagos, Nigeria. Etsi, welcome. Thank you so much for joining me.
Okay. So my name is Dr. Igebu. I'm a resident in training in Lagos University Teaching Hospital in Lagos, Nigeria, and in West Africa. So we are 41 people in training and consultants in a population of 200 million people in Nigeria. So we are training people, we are managing people with rheumatic diseases, especially, and it's grown. Over the period of 10 years, it's grown tremendously. We're seeing more patients, we are having more consultants, and we're having more interest in rheumatic diseases, with the medical students being interested and the general practitioners being interested as well.
That's fantastic. So, Etsi, one of the questions that I wanted to ask you was, with regards to Nigeria in specific, what are some of the manifestations of lupus, and how do you feel like that is relevant for our communities in America, particularly with our African American population?
Lupus was previously thought to be uncommon in Nigeria because there was paucity of data. But in recent times, we're finding that lupus is very common. And we're seeing similarities in the clinical manifestations with people in African American people with Nigerians as well. Because most of the African American people are descendants from West Africa in particular, and that's where Nigeria is. So they have similar manifestations. Typically, of worry for us is the lupus nephritis, which is so common in Nigerians, and sometimes it's the first manifestations we see. Like the Caucasians that have the mallow rash, we typically don't see patients with mallow rash. We see with lupus nephritis, neuropsychiatric manifestations, and the hematological manifestation. However, the most popular clinical manifestations are the polyarthritis and polyarthralgia. But worrisome for us is the lupus nephritis because it has a very quick progression to end-stage renal diseases. So knowing that and curbing it early is very important for us in our management. So now we have a policy that most young people with an elevated ESR that come on with chronic kidney disease, we tend to screen them for systemic lupus erythematosus. And we have seen increasing number of patients presenting with lupus nephritis.
Very interesting. Can you discuss a clinical trial that's going on at Lagos Teaching Hospital?
Okay. Presently, we have this trial going on. It's called the APO1 gene trial, where we are assessing patients with lupus nephritis and seeing if there's a genetic predisposition to it. We've started in Lagos, and we intend for it to spread throughout the whole country. So what we do for the patients basically is when we see them, patients that have been diagnosed with lupus using the ACR criteria or the SLEEK criteria, we assess them. We do the gene study, the APO1 gene study. We look for cytokines, and we follow them up for a period of 1 year. We do the SLEEK to assess the SLEEK to diagnose them. We do the SLEDI to assess their disease activity, as well as to assess damage. So we've just started the study, and we're recruiting patients now, and we intend for it to last for a period of 1 year.
Okay. Can you give us any updates from the AFLAR meeting earlier this morning?
Okay. For the first time, AFLAR meeting started last year, and we had another one. Initially, we had a 1 hour AFLAR meeting last year, but this year we progressed to 1 hour 30 minutes. So our strong point in the meeting was to tell people that rheumatic diseases and rheumatological manifestations are not as uncommon as previously thought. So we had presentations saying the burden of rheumatic diseases in Africa, as opposed to the previously thought that most of the burdens were infectious disease. And we had to also say that pediatrics, juvenile rheumatoid arthritis, common, and we're seeing a lot. pediatric rheumatic diseases as well as common, and we're seeing a lot too. And also that there needs to be advocacy. We need to advocate for the patients. The medical students are supposed to be taught these diseases in medical school so it can spread over them, because most times in Africa they are the first point of contact, the medical students and the medical officers, and so they can do early referrals and patients can be treated on time. Also, we need to collaborate with the international community in the sense that we should have people come over. Nigeria, we're lucky, as I said, we have 41 people in training, but some places in East Africa, there are no special rheumatologists. So patients are being seen by the general practitioners. So by the time we have people coming, exchange programs being done, people sent to those places, and people are also sent to the Western world, and then people they now know that are trained both ways, and it can help in management of this patient.
Okay. You actually mentioned an exchange program, which was my next question. The ACR does have an exchange program between PANLAR and the ACR, where a fellow from both governing bodies will actually go spend 4 weeks, and then vice versa. Do you feel like there would be a benefit from an exchange between AFLAR and ACR, or even a potential collaboration, for example, physicians going to Africa and helping to train in foster interest in rheumatic diseases?
Yeah, I think it would be very helpful, because as I said earlier on that we don't have so much challenge in West Africa now, because we have a training. We're being trained by Professor Adelowo. He's the only one certified to train in West Africa, and he's trained a lot of people. So he's gone from being the father of rheumatology there to the grandfather of rheumatology, because people he's trained are now training people. But in East Africa, there's paucity of rheumatologists. So it will be very helpful for them if rheumatologists are sent there. Likewise, people are trained with interest and are sponsored to do the training in the Western world, to improve their knowledge and to better, at the long run, better the patient's outcome.
Okay. Thank you so much, Dr. Igebu, for being with us today. Thank you for joining us. You can find us at #ACR18 and also at RoomNow on Twitter, and also roomnow.com. Thank you.